Now, for the next antiviral drug, this is what is known as the Amprenavir. Amprenavir. So we get to talk about the pharmacology of this Amprenavir, okay, and make a lot of sense out of it. So for the drug Amprenavir, we said that is a drug. Okay, so it's a HIV drug. So HIV drugs have classifications, and this classification is based on how they work. So this one is a protease inhibitor. Okay, so it's used in treatment of HIV. Okay, so let's look at the drug profile. So the HIV-1 protease inhibitor. Okay, how does it work? It will bind to the active site of HIV-1 protease. Anything ACE is an enzyme, right? So this will now prevent the cleavage of GAG and GAG-pol polyprotein precursors. Once those polyproteins are not being able to cleave, okay, it will now result into, yes, the virus can be making copies of itself, but it will never mature. Do you understand? So you have immature copies of virus being formed, and they are non-infectious. Of course, if the virus is not mature, it can cause issues to you. Okay, so pharmacokinetics, absorption is orally given, and when you take food and you take this drug, can actually tend to reduce how the drug will act. Distribution is highly protein bound. Metabolism is in the liver. Excretion is through the feces. Okay, half-life is about 7 to 10 hours. So it's mainly used in treating HIV infection in adults and children. Okay, so adverse effects can cause nausea, diarrhea, rashes. Okay, then sometimes lipodystrophy. Then sometimes hyperlipidemia. Okay, then also insulin resistance can also be a thing. Okay, which could be a problem when taking this drug.